This is a great place to be if you desire to take charge of your health so you can live fully and enjoy doing what you love. And I'm here today with a special guest, Dr. Cheruba Prabakar, also known as the Fibroid Doc. She's a board-certified OBGYN, fellowship trained in minimally invasive surgery, and CEO of Lamorinda Gynecology and Surgery. And we're going to be discussing all things fibroids. So this should be a wonderful discussion. Welcome, Dr. Cheruba.
Thank you so much for having me. This is very exciting.
Awesome. So before we get into it, you're listening to Connecting the Dots with Dr. Ashaye. I'm your host, Lola Ashaye. I'm a family medicine and lifestyle medicine doctor and owner of In Touch Primary Care, which is a membership clinic in Sugar Land, Texas. And if you're seeking more convenient and a more proactive approach to your healthcare, come join us. You can enroll at www.intouchprimarycare.com. And remember, you can always listen to this episode and all our other episodes on the In Touch Primary Care YouTube channel. Leave comments, subscribe, and please share with someone that might need it. You never know, it might make a huge difference for them. All right, so let's get into it. I'm really excited about this one. So, Dr. Cheruba, can you tell us a little bit more about yourself personally and or professionally?
Yes, so that was a great introduction. I am a board certified OBGYN. I trained in the East Coast of the US, and once I finished my residency, I really wanted to focus a little bit more on the surgical aspect. And so I did a fellowship in minimally invasive surgery in New York. And my program was in Brooklyn, New York. So very, very diverse place where I got a lot of, cool training. And one of the things I saw a lot was women with fibroids. And so I did a lot of cases, for these women during fellowship, and it sort of became an interest of mine and a niche of mine. And then after fellowship, I moved to the West Coast into California, and I set up, I joined a practice in Oakland, which reminded me a lot of Brooklyn in terms of the diversity that I saw in terms of my patient population. And guess what? I saw more fibroids. And so it really became my passion to take care of women with fibroids. And I started to get more interested in fibroids and what causes them and all of that. And so that's why I'm the Fibroid Doc.
Fantastic. Yeah. And I know you mentioned the additional specialized training in the latest surgical treatments, which is something you can offer your patients. What are other common conditions that you treat in your patient population?
Yes, so I see patients with abnormal uterine bleeding caused either because of fibroids or polyps. I also treat patients with endometriosis, ovarian cysts, and abnormal pap tests. That's another big one that patients are very concerned about. And so I work that up and treat them further for that. I also take care of women who just want a, annual exam and want to be up to date on all of the things that they need to be doing. And they want to make sure they're not missing anything. So that's what I do in my practice now.
Awesome. Great. So let's get into fibroids. So what are some common risk factors and causes for fibroids? And when you have fibroids, does that mean that you're going to have it forever?
Yeah, so that is the holy grail and the $1 million question as to what causes fibroids. There's a lot of research being done, and in my opinion, not fast enough, because a lot of women suffer from fibroids. And the biggest thing we know right now, is genetics. Like a lot of health conditions, genetics plays a role. So a lot of patients will say to me, well, my mom had fibroids, and my grandmother and my aunt, they all had fibroids, and they had their uterus taken out, at an early age. So if you're somebody who has that family history, and if you don't know, it's good to ask also to just for your own, knowledge. That can definitely be a risk factor if your mom had fibroids and your grandmother and your aunt and your sister and your cousins. But interestingly, other than that, we don't have any good answers as to what causes fibroids. There's been various speculation on diet and exercise. There was one study that said, maybe chemical hair straighteners were causing it. But really nothing has really held up. And we have some large studies now coming up on the role of diet. So that's something that I always talk to patients about. And it's just not for fibroids, it's for overall health. And you know that as a primary care doctor, right? You're always talking to patients about diet and exercise. So certainly those can have a role, but we don't have any other clear reasons as to why fibroids form, which is frustrating for a lot of patients and doctors as well.
Yeah, yeah. And then if they do have them, what can they expect in terms of like, is it something they'll have to deal with forever?
A lot of fibroids, if you do nothing, they're just going to stay there. Sometimes with menopause in your mid 50s, they can shrink. It's rare that they completely go away. So the best case scenario with a fibroid is it's 4 centimeters. It stays 4 centimeters during menopause. It becomes 2, and then it just kind of hangs out there. Yeah.
Right. Awesome. So what else? So fibroids are so common. We already talked about it. And sometimes it causes a lot of anxiety, especially when it impacts fertility. So when should people with fibroids be worried? Like, and what are some early symptoms and that they do have fibroids?
Yeah, so 25% of patients who have fibroids will actually be symptomatic. And by the time you hit 50, 70% of all women will be diagnosed with a fibroid, which is kind of a sobering fact. And 80% of Black women will be diagnosed with a fibroid. It is more common in Black women. But out of all those women, 1 out of 4 will actually be symptomatic. And when we talk about common symptoms, the number one thing that I see in office is heavy bleeding. Patients have very heavy periods. They're soaking through their pads. They're soaking through their pants. They can't leave the house for meetings, or, it's just an embarrassing social problem. For others, it's pain and pressure. So they'll say like, oh, I feel this big like mass, like a ball in my belly. Every time I turn around or I try to sleep on my stomach, I feel this big thing on my stomach. Some patients have to go pee a lot because it's almost like this big ball is sitting over your bladder because the uterus lies right behind the bladder. And so patients will pee a lot. So these are all things that help clue us into the fact that a patient may have fibroids. So if you're experiencing any of that, certainly you should definitely, see a doctor, get an exam, and usually a doctor will also order an ultrasound.
Right. Right. And then when should they be worried about how it will affect their fertility?
Fertility, yeah. So if you're not symptomatic from fibroids, a lot of patients don't know they have fibroids, right? We're not walking around getting scans yearly or anything. So by the time by the time they have kids in their 20s or 30s, when they go in for an ultrasound, when they get pregnant, a lot of times that's the first time a patient even finds out that they have fibroids. But for patients who are not able to get pregnant, say they're having, they've been trying for a year, they can't get pregnant, or they are having multiple miscarriages, then for those patients, an ultrasound often will be ordered. And then you may find out that, oh, I have a fibroid that's sitting right inside my cavity that's causing these miscarriages, or that's preventing me from getting pregnant. So that's often how patients find out.
Right, right. And I think that that's important that we address, because sometimes I've had patients who are very worried about it, and they may not even need to worry, because it's not in a place that it will affect their pregnancy at all, but they know they have it and they're worried about it. And, we can't predict that ahead of time, who is going to be affected by a fibroid and how it's going to affect fertility. So that's
right. For patients who know they have a fibroid, I tell them, okay, whenever you're ready to get pregnant, just do an ultrasound beforehand, because, maybe it's not affecting them. They don't need to do anything about it. But, 10 years down the line, they may want to get pregnant. And at that time, who knows, maybe it's grown, maybe now it's pushing into the cavity. So you want to be aware of that prior. And if you need surgical intervention prior to getting pregnant, you want to do that. So, so if you know you have a fibroid, then just keep an eye on it, maybe the year before you're trying to conceive.
right. Great. That's great advice. Thank you. So can you give 3 practical examples of what people with fibroids can do to reduce their pain or bleeding?
Yes. So there's a lot of great treatments now for fibroids. Everybody wants a natural cure. And right, that's the first thing patients ask me, well, what can I take? What pill, what supplement, what can I drink? What exercise can I do that's going to take this away? And with good reason, right? We want to try the most conservative things first. And right now, we don't have an answer for that. What I do tell patients is that if you've got fibroids, it's causing bleeding, it's causing pain, let's start to really look at what you're eating. Let's really try to detox your life, right? In terms of your eating, your diet. Are you exercising? Are you smoking? Are you drinking alcohol? So really examining the sort of the diet and exercise part of it and how you're living your life, stress, and paying attention to that. We live in a very fast-paced world, right? We barely have time to take care of ourselves, but I try to have that conversation with patients because a lot of times when they tweak how they're actually eating, things may change. A diet that's rich in cruciferous vegetables, such as cauliflower and broccoli, have actually shown to reduce the growth and reduce the recurrence of fibroids. That's a huge paper out of China that came out a couple of years ago. And so really paying attention to that can help. So that's the first thing that I would suggest. If you're already doing that and you're doing all those things and you're still having bad bleeding, secondly, you could also do acupuncture and sometimes Chinese herbs, and these help as well. A lot of my patients do this in conjunction with a healthy diet and exercising, and they're able to get at least their bleeding under control. Some patients will want some medication management because this helps a little bit. It's a stronger effect on bleeding. So we've got the birth control pills. We've got all sorts of hormonal things. We've got the IUD, the Mirena IUD that can help with bleeding. And we've got medications like Orion or Myfembry, all of these. So the second category is, medical management. So that's one step that they can take. And oftentimes these don't really have a lot of bad side effects or anything. So patients tolerate it well, and they're able to live a life with reduced bleeding and pain. And lastly, is surgical management. So if they failed the diet and exercise, they failed the medical management, and now the quality of life is poor and they need to do something, then surgery would be recommended. Or if they are actually trying to get pregnant and they can't have this big fibroid sitting there, they really need to remove it. That's not the time that I would try diet and exercise. So I would just recommend that they remove it. So it can be approached in multiple different ways, depending on what the patient's goals are.
Right. And that's great because there's hope, for people that have fibroids, that there is something that can be done. So if that's the case, just starting out with the foundational things you talked about, lifestyle changes with diet, exercise, reducing stress, avoiding alcohol, smoking, things like that. And then, medications can help in many people. And then if all that is not helping, then we can go to, surgical management. But treating it can be a huge, can really change a person's quality of life for good. So it's something that shouldn't be ignored. It should be addressed, as soon as possible so that, it makes a huge difference when it's treated.
Yes, 100% agree. And I think just educating yourself on the options and, being proactive about getting that care.
Yeah, absolutely. So let's get into your new practice in Lafayette, California. So can you tell us more about Lamorinda Gynecology and Surgery, and how is it different from a traditional gynae practice? How do patients benefit? Like we're excited to learn more about this.
Yeah, thank you. So I started this practice just last month. So it's brand new, and it's been a dream of mine actually for a long time. But I finally did it. And I opened doors October 3rd. So in this practice, I do gynecology and surgery. So I don't do obstetrics, which is the baby's part. And it's a direct specialty care practice. And what that means is patients pay upfront for their care and potentially get reimbursed by the insurance. And this often turns off a lot of patients because they're like, oh, you don't take insurance and whatnot. But what this allows me to do is it allows me to provide very, very high access to patients. So instead of waiting for 3 to 6 months to get an appointment somewhere, they can see me the same week or the next week, because I'm not trying to see 30 patients a day. I'm trying to really spend a lot of time with patients, really get to know them, really look at their history carefully, and give them a very comprehensive, plan. And that takes time. And it's not something that you can do in 10 or 15 minutes. Secondly, it's very personalized. So again, I know all my patients. I'm the only doctor in my practice. And so everybody who comes through, I know a lot about them. And again, I don't have 2,000 patients. And so I manage a smaller population and really get to know them well. So the access alone is huge, because when you have a problem or you're trying to get pregnant and you need that fibroid taken out, you don't have 6 months, you're 38, 39 years old. You wanted this done like, yesterday, right? So my practice allows for that kind of access and that kind of personalized care. And I'm able to do that by being out of network with insurance. And I do have a biller in my practice who bills for patients, bills on their behalf to the insurance to try and get them a reimbursement. A lot of people think it's a cash only practice, and that's actually not true, because I am out of network, and a lot of patients do have out of network benefits. And so sometimes they do get, a good amount of the visit reimbursed. And when it comes to surgery, I perform the surgery in an in-network facility for the insurance. So everything that we do at the hospital, the anesthesia, the surgery, all of that is like it would have been in any other practice. It is only my professional fees that I don't bill insurance, and they pay out of pocket for that.
Okay, that's a wonderful setup, because like you said, it really increases the access to patients so that they can get their needs addressed in a very detailed, personalized fashion, which, a lot of times that just make they get their symptoms sorted so much quicker. They feel better faster. They can go ahead and get pregnant if that's what they desire. I mean, so many awesome benefits. So yeah.
Yeah, no, it's really great. I think a lot of medicine is swinging this way now, because when you have a problem, I think there's nothing worse than waiting 3 months for an appointment, and then still you look at your phone and you still have all these questions that you wrote down like unanswered, because the doctor is moving on to the next patient, right? So I think that's very frustrating for patients. It's also frustrating as a doctor, to know that you would love to spend an hour with every patient, but it's just not possible. So I think this allows me to practice medicine, the way I want to, in my own terms.
Right. No, that's great. That's great. And it also reduces how much people are Googling and, getting inaccurate information and trying different things that could be harmful. So
exactly. Yes. If they have a question, they just quickly, send me a message, and I'm answer them right away. And they're not having to see 3 or 4 different people in the office. It's very personalized. And so, it's a good model.
Yeah, thank you for sharing that. So can you do you have any parting words or advice or anything you want to leave with our listeners today?
Yeah, so I would say, advocate for your own health. That is my biggest message. I don't know if you followed Sharon Stone's story just last week. She had a large fibroid that was misdiagnosed, and then she went from doctor to doctor, and finally they diagnosed her with a fibroid, and they took it out. And she was just talking about how like this, how did this happen? And Sharon Stone is an actress, and I'm thinking this person has a lot of money and access and the best doctors. And so if that could happen to somebody like her, it's definitely happening to all of us, right? So I really ask patients to take charge of their own health, seek the specialist care if that's what you need, and try to get your information at a high level. So the good thing about media is it's good and bad. There's a lot of information out there. There's a lot of fake news. But the good thing is a lot of doctors have their own websites and their Instagram channels and their YouTubes and all of that. And so that's a great way to get information. So by using all of that, just being really proactive about your own health.
Yes, absolutely. That's great advice. Thank you. So how can people find you? Do you have a website, social media handles? How can they connect with you?
Yes. So my website is www.lamorinda.gyn.com. So you can find a lot about my practice there. And I am the Fibroid Doc on Instagram and YouTube. So you can find me there for a lot of videos and information on fibroids. And I also offer fibroid coaching. So you can be anywhere in the country or the world. And if you're somebody who is just overwhelmed with all the decisions you need to make about fibroids and confused about all the information and you need more clarity, you can sign up with me at thefibroiddoc@gmail.com.
Great. Okay, that's great. So we will have all that information in the chats or in the handle as well, so that people can, connect with you. But thank you so much for joining us today and sharing all that information. We've learned a lot. I've learned a lot too. So
Yeah, thank you
thank
for
you.
having me. This is great.
Great. So thank you for listening. And remember to subscribe and share with someone that may need it. And if you are in the Houston area and you would like to experience the peace of mind that comes with being able to reach your doctor when you need it, come join our membership practice at In Touch Primary Care. You can enroll on our website, www.intouchprimarycare.com. And thank you for joining. Have a great day.